Hello and welcome to the first edition of Inside OSA, an informational program for people with obstructive sleep apnea. I'm Sherry Smith and this is medical correspondent John Matthews. Like exercise and nutrition, the quality of one's sleep has a direct impact on the quality of one's life. Yet for an estimated 20 million Americans, refreshing sleep is an elusive dream. Inside OSA focuses on the most common form of sleep-disordered breathing and how it can easily be diagnosed and effectively treated.
OSA, or obstructive sleep apnea, is both the most common and the most troubling sleep-related breathing disorder. OSA causes a person to stop breathing repeatedly during sleep. These nighttime pauses in breathing prevent restorative sleep and have far-reaching consequences for overall health and well-being. When most people are asleep, air flows freely through the upper airways into the lungs, giving a stable level of oxygen in the bloodstream. In individuals with OSA, the tongue and soft tissue in the airway relax during sleep. As the tongue and tissue partially obstruct the upper airway, it causes loud snoring. When the tongue and tissue totally obstruct the airway, it causes an apnea and breathing stops. The chest continues to move as the person tries to breathe, but the blockage prevents fresh air from reaching the lungs. The oxygen content in the blood goes down. An apnea may last anywhere from 10 to 60 seconds before the brain recognizes that there is a problem. The brain briefly arouses the body from sleep, just enough to open the airway. The person with OSA can be observed snorting, gasping, or choking for breath as the airway opens and air flows back into the lungs. After several breaths, the oxygen level in the blood is restored. The individual falls back into a deeper stage of sleep. The tongue and soft tissue relax again, and the airway becomes obstructed. Apneic episodes can happen hundreds of times in a single night. The individual is most often not aware of their frequent arousals from sleep. They wake up feeling exhausted and sleep-deprived, even though they spent adequate time in bed sleeping. Although not as well known, sleep apnea is as common as adult diabetes and asthma. Recent studies show that roughly 1 in 20 Americans have some form of sleep-disordered breathing. Roughly 90% of people with sleep-disordered breathing are undiagnosed. Family members often describe excessive snoring, nighttime pauses in breathing, and snorting and gasping or choking for air during sleep. The most common symptom of OSA is excessive daytime sleepiness, despite spending adequate time in bed sleeping. Additional symptoms may include morning headaches, difficulty concentrating, memory loss, irritability, depression, lack of sexual desire, or impotence.
My name is Tae Siong. I'm 44 years old. I work as a business communication manager in a local company, and I suffer from sleep apnea. When I got married about 10 years ago, my wife told me that I snore a lot and I often stop breathing during the night. And at work, I was also very lethargic. I often fall asleep in the meeting, and when I attend courses, I also doze off easily.
First off is snoring. The snoring is due to the collapse of the airway during sleep and can disrupt the sleeping partner. Poor sleep quality can result from the recurrent choking during sleep, and this can result in poor memory. It can affect the concentration during the daytime and can affect the work or school performance. First is the increased risk of medical conditions like high blood pressure, heart diseases, strokes, and diabetes.
When my family life, work life and social life has been affected, I think that it's about time for me to do something about it. So I decided to see my company doctor, and he recommended me to see an ENT doctor. And he thinks that I may be suffering from sleep apnea. So he referred me to a sleep test at the hospital.
There are a few available. First off is continuous positive airway pressure, which is also known as CPAP. There are dental devices that you can use, and surgery may be suitable for some patients as well.
And at the end of the test, I was told that my breathing stopped 50 times in an hour, which was very alarming to me. So the doctor actually recommended me to use a CPAP machine. When I first got this CPAP machine, I was very surprised because, wow, it's so small. I decided to try it on, and the mask is also less intrusive and very comfortable for me to use. So during the night, my wife and I sleep very well. After using this new CPAP machine, I stopped snoring altogether. So it means good sleep for my wife and myself. With the added rest, my energy level has gone up and has improved my work a lot. In terms of family, I could also spend more time with my kids, my wife, and we go outings a lot. This machine, because it's so compact and small, I could bring it anywhere with me, to overseas, to a friend's place, to a chalet. This is really good for me. If the doctor diagnosed that you have sleep apnea, I would recommend you to use CPAP machine because CPAP machine has changed my life in a positive way.